Telling someone that their loved one has a terminal disease isn't easy. It's not something I enjoy about my job. It's something I hate about my job because I make people cry on a daily basis. It takes me a while to actually get up the courage to tell them. My nurses watch me walk around the hospital, and they know why I'm doing it. I have to actually get the courage to walk in the room. Hi, my name's Dr. Turner. How are you today? I'm sorry that you have to be here today. Has your veterinarian talked to you about the diagnosis for Daisy? Well, I'm sorry, but Daisy's been diagnosed with a very aggressive bone cancer called osteosarcoma. You see what that pet means to them the second you tell them what could happen and what they're up against. Most people close down and stop wanting to know. They just focus on the end. Not everything is a death sentence, and not everything's a death sentence tomorrow. There could be many different options, and one may work really well for you and your dog. Get the information, because knowledge is power. I've been a veterinary oncologist for a very long time, and the one thing that still surprises me is how many pet owners assume there are no options when their pet is diagnosed with cancer. I can't lie and tell you there's a cure. There isn't. Not yet, anyway. And I can't always promise a happy ending. Some forms of the disease have better outcomes than others, and some, like osteosarcoma, can come with a grim prognosis. Our goal is to give you more time with your best friend and ensure that they have a great quality of life while they continue to do what they love. But first, it's important to understand what you're dealing with. How many of you have had a pet that's had cancer before? A lot of hands go up. And this is a common response. Cancer is really, really common in the veterinary world. And so hopefully today we can talk about some things and dispel some myths and hopefully go home with more information. The question I always get from my clients is, what is cancer? Like, where does it come from?
Cancer simply is a genetic blip within the cell that causes it to divide uncontrollably.
Cancer is kind of like your ice maker that's little bar doesn't go down. So it's just making more and more replications of itself to the point of excess.
Why do our dogs and cats get cancer? It's a combination. You may have a genetic predisposition or a mutated gene that happens during your life that can set you up to have cancer. There are environmental risk factors. What that means is there's not just one thing you can do to stop cancer from developing. And then the other factor is just bad luck.
There are some breeds that appear to be genetically predisposed to bone cancer.
Typically, the animals we see are dogs that have kind of a rapid growth trajectory. So those kind of large to giant breed dogs that grow rapidly in their first year of age.
But really, I've seen it in any breed of dog.
Bone cancer comes in many different forms, but by far the most common, as well as one of the most destructive, is osteosarcoma.
Osteosarcoma is a bone tumor that affects the limb bones and sometimes other bones in animals. It's an aggressive tumor that kind of eats through the bone from the inside out, and it can spread elsewhere in the body as well.
You can see the extent of the loss of bone. We've almost completely lost the proximal aspect of this tibia here. So you can see when osteosarcoma progresses, we get extensive bone disease here.
85 to 90% of dogs with osteosarcoma at the time of diagnosis of the osteosarcoma already have micrometastasis, of spread of the disease on a microscopic level.
When we x-rayed her chest, radiographed her chest, we can see that she has nodules. These are rounded, soft tissue nodules within the thorax itself, and those are very characteristic for metastasis to the lungs. Osteosarcoma is associated with bone loss. It causes demineralization within the bone itself. Now that causes the bone to actually become weaker and predisposes it to fracture.
These tumors that start in the bones, and typically in one of the long bones in these large breed dogs, are very painful. They're sort of destroying that normal bone architecture, and it's very uncomfortable, and it's very difficult to control with oral pain medications.
So this is a distal femur primary bone tumor. And if you look at it, this is normal bone. You can see the normal cortex. But then when we get down here, it starts to get puffy. That's called a periosteal reaction. That's all secondary. It's mad, it's pissed off at us. And in here, you can see these kind of punched out holes. That's all the moth-eating appearance. So if I look at that x-ray and I make an educated guess, I can be pretty certain, probably 90%, 95%, that this is a primary bone tumor.
We will confirm or try to make a solid diagnosis, not just on x-rays, but by doing a biopsy. And that may be a needle biopsy or a slightly larger tissue biopsy that we can get of the lesion, have a pathologist look at it and confirm the diagnosis of sarcoma or osteosarcoma in the bone.
The thing I think is tough with bone cancer is that most dogs are going to be older. Most dogs are going to be, in their senior years of life. So what happens when you're a senior, like myself even? What happens? You get up in the morning and what? A little crotchety, you're a little limpy. Things kind of hurt, right? Right. So this is subtle. Sometimes their pain, especially if you have a dog that's pretty pain tolerant, it's subtle. It looks like arthritis. You have an old dog. And when dogs get older, we tend to start dismissing some of these things.
If your dog shows up with a lameness, that doesn't automatically mean he has bone cancer. There are lots of different things that can mimic osteosarcoma. The most important thing, though, is if your dog comes up lame, or they're licking their wrist, or you see a bump, is to get into your primary veterinarian right away. And don't just settle for anti-inflammatories. Push for x-rays early in the signs and symptoms that you're seeing in your pet.
If we can get to those patients when the tumor's first starting, there's the potential for things like limb spare, amputation, potentially doing localized radiation plus systemic chemotherapy. But all of those things, the response to those treatments goes down dramatically as the cancer burden increases as time goes by and the disease spreads beyond the primary site.
Be proactive, don't stick your head in the sand like an emu. Don't do that. I think about it. I'm a doctor, and when my pet's sick, I like to stick my head in the sand for a minute, and then I have to remember what I preach. I know it sucks to maybe hear that something's bad with your dog, but it's much better to catch it before it's caused a lot of damage.
Once you receive a diagnosis of cancer, the clock has started, and you need to try to make your way through those next steps with forward movement. But it certainly does not mean the end as soon as you hear the C word.
Tice is 3/4 doofus, 3/4 sweet love, 3/4 rabble-rouser, and I know that adds up way above one because he is more than one. He's many dogs all rolled up into one, and I just love him.
Tice is an agility dog, and they noticed that Tice was off, just subtly weaving through the poles. It was a very subtle lameness. Most dogs, when they're diagnosed, are almost not using the leg or walking on the leg, or the leg is swollen.
I knew what osteosarcoma was. I knew it was bone cancer. I knew it was bad. I knew that dogs didn't live very long. That's all I knew.
You want to let's go this way. These shouldn't be interwoven in such a haphazard
I had
procession.
to start to educate myself a little bit more because before the diagnosis, I was sure I was not going to amputate his leg. I was absolutely sure.
The word amputation carries a lot of emotional baggage. I think as humans, we immediately think about what it would be for us to lose one of our limbs, particularly our lower legs. Dogs are four-legged, and so the loss of a leg is not as devastating to them by any means because their bodies are prepared to handle life on three legs.
So this is the pelvis, okay? This is the femur bone as it comes down,
Okay.
okay? We amputate here.
We sort of make what's called an elliptical incision, so we cut like this, same thing on the other side, and then we disarticulate the hip, so we cut through the joint capsule and the muscles around the hip, and they're left basically with an incision site that comes across like that.
Robert and I talked quite a bit about what to do and what not to do. I knew I was going to do the amputation, I just didn't know when.
The main risk with waiting to amputate is that the bone can fracture through the tumour, and that can cause a lot of pain and turn the situation into a surgical emergency.
Lux's favorite thing to do is play with lemons. When we go on walks, she knows every house has a lemon tree. We always have to get her one. She carries it the whole walk. She brings it home. She plays with it. You have to throw it to her. And then she usually eats it.
Lux is a very young dog, which is one thing that we do worry about. Being a young dog is a little bit of a negative prognostic sign. If you think about it, the younger you are when you get cancer, the less you've been exposed to environmentally and toxin-wise. So to develop cancer in a younger dog versus an older dog is sometimes one of the red flags.
From the standpoint of an ultrasound, I'd like to have her have that. Sure, what we find with vitalized surgery, but not because
We caught Lux's cancer probably as early as we could.
When we looked at Lux's x-rays, it appeared that we had an option for something called the limb spare. Limb sparing procedures can be performed in multiple ways.
Not all dogs are going to be candidates because of the location. The bones that we can spare are the ulna, the radius, and sometimes the tibia. Not many dogs qualify for those procedures. It's kind of the right dog, right owner, right situation.
When the ulna is affected, a limb sparing option is called an ulnectomy, where we remove the bottom part of the ulna bone. If on CT we see tumor going quite extensively, we have to get a margin of, so just to, if this is like just basic tumor physiology.
Sure, yeah.
If this is a tumor, there are these tendrils of cells that extend away from it. Okay. And so if you cut right around the edges, you leave these cells behind and the tumor can regrow. Right. And so you want to cut out here with a margin of normal tissue in every direction.
Okay. I chose limb sparing because it was an option put out on the table for her to keep her leg. She's a real active dog, and I'd like to see her get back to doing the things that she likes.
So 2 days later, we were on a hike, and he's out there running full force. And I noticed that there was some very slight swelling right where the bone biopsy was done. When I saw it, it was like I got home, I called the vet, and I said, when can we come in? It was heartbreaking to see him jump into the car, knowing it was probably the last time he'd do that. Funny, he jumped on a towel, and I saved the paw prints. This is your new day, new life, okay?
It's hard.
I know. Oh, there's Dad. Yeah, it's all about Dad, huh? I love you. I did have preconceived ideas about amputation. Everybody told me dogs adapt. You're going to be surprised. You'll be incredibly surprised.
We know what we're going to get a lot of times if we don't treat. You know, that's where the statistics are pretty consistent. And some dogs are going to do better than what statistics would even expect. So if we have a treatment that potentially could help them, I think it's worth fighting for, especially if the only thing wrong with that dog is its diagnosis of cancer. In Tice's case, he had a biopsy prior to coming in that said it was an osteosarcoma. However, when we sent in the entire limb and they were able to take bigger sections, they were able to differentiate it into the less aggressive tumor, which was the fibrosarcoma.
When he came in after the surgery and just ran into that room, I mean, I was expecting them to either bring him in on something or, you know, help him walk or anything, you know, and he just charged right into the exam room and
you want to go home?
fell into my lap, but it was all I saw was him. But it's still a huge step, and I had to mentally kind of get there. And I did that a lot faster than I thought I would.
I love this dog so much. I know she's gonna do fine. It's really hard to drop her off. She's never been without me. Lucky, I love you.
Lex's case is so specific. In the vast majority of dogs, when you talk about limb spare, you're not just removing the ulna, you're actually removing the radius bone and putting in an implant. And that's more commonly what we think of when we talk about limb spare.
Kim, are you good?
Lux handled her surgery great. She came home the next day with a cast on. And I'd say 2 days later, she was running around, which she wasn't supposed to be doing, so I had to kind of keep her quiet.
Let's go, Lux. Yay! Look at you walking. Okay, Dr. Carey.
Oh my God, this looks amazing. Lux, you are an unbelievably well-healed dog.
Oh, I know.
We know with osteosarcoma, 90% of them will spread. So if we do chemotherapy to buy those dogs more time and to kill those microscopic metastases that are hiding out in the system. Dogs tend to handle chemotherapy much better than people. People, they use something called the maximum tolerated dose, and we don't even approach that in veterinary medicine. We use doses that are made to control disease but not necessarily cause symptoms.
We need to attack cancer from a variety of directions, complementary therapies.
I'm gonna eat it. It's not food, but this is what we're doing.
She's getting acupuncture and physical therapy, and she's getting some supplements. I've also changed her diet. She's almost completely off kibble. She just gets about 1/4 of a cup, and she's getting cooked turkey and vegetables.
If you eat a diet that's causing inflammation and your body's overly inflamed, you're not making yourself any better. We want to feed a cancer patient in ways that make life miserable for the cancer cells.
No carrots, only a small amount of sweet potato, no white potato ever, unless your dog has food allergy and you don't have any other choice. No. Those are just straight up sugar. They go right in the stomach and go right in the bloodstream straight to the tumor, and the tumor gets out and goes, yes, French fries. Okay.
We're giving Lux some medications that stimulate the immune system. They're antioxidant, they reduce oxidative damage, they help cellular repair, and they kind of move toxins out of the area.
Chinese medicine has 9,000 individual herbs, and each one of those herbs is a cluster of God only knows how many chemicals. And when we put them together in interesting ways, we can do things that we can't do with conventional drugs yet, or that we're just starting to do with conventional drugs.
She's so stoic and so strong, and I'm the one that's a wreck, and I'm the one that has to keep telling myself that I have to stay positive for her.
Tice's life has changed. He does things differently. He knows he has to do things differently, but he still gets up on the bed. Sometimes it's with the stairs, sometimes he just jumps. We don't go on 5 to 10 mile hikes, or at least not yet, but I can see that we'll be going on longer hikes in the future. It's a matter of time. And when we get there, then I would say his life has hardly changed at all. But we're not there yet.
Just sort of go up by a few minutes each week, and within 4 weeks you should be. When I talk to owners about postoperative function, I oftentimes talk to them about the benefits that they can hope to achieve with physical therapy. Physical therapy just helps to strengthen the surrounding musculature. They do work a lot on core strength, and they work on sort of helping dogs adjust by strengthening the remaining limbs.
So I'm going to measure that just so we can kind of follow up on that range of motion later. When Tice first came in, he really wasn't using his legs properly under his body. He hadn't figured out how to do it, and he also had enough neck and spinal pain that he was making compensatory movements with his body.
Prime of my life. Gotta get naked, babe.
So I did an acupuncture treatment for him. He did relax, and afterwards, he actually stood straighter. He actually wasn't kind of sideways, but he actually looked almost like he was supposed to look, a straight dog, and we were all pretty happy with that outcome.
I think Tice is doing fantastic. He's still doing agility, he's still looking sexy. I believe Tice's prognosis is good. Dixie did everything that was recommended. She did surgery, she followed with chemotherapy. He has a slightly less aggressive bone tumor, so we've had a really good run with Tice so far.
He has cancer. I do know that we caught it early. That means we have a good prognosis. I know we took the leg, which means we had the biggest margins ever. I know that he's not acting any differently, so I'm hoping that there's a good prognosis. I don't really like to think in months, days, or weeks, so I don't go there.
Fighting cancer is kind of up and down. You know, in the beginning, you are all positive because there's so many things you can do, and you're optimistic because all things are possible. But with medicine, nothing's predictable.
She was at a nosework trial, and she was really warm. So I took her to the vet, and it turns out that her white blood cell count had dropped and she had an infection. While she was there getting the blood work, they also took a chest x-ray, and they found 2 spots in her lungs.
The lungs are a common location for all tumors to spread to because of the blood flow. You know, it's a very rich environment. There's a lot of oxygen and there's a lot of blood. And if you're a seed and you're trying to grow, you look for areas where it's easy and comfortable.
Over the last 3 or 4 days, Lux's leg has gotten progressively more swollen, and the bump on her leg has gotten bigger. So I took her to Access Emergency Hospital. They did an x-ray, didn't see anything, so they did a needle aspiration. So if it comes back cancer, one of the options is possibly amputation, but I need to talk to Dr. Turner and find out what all the options are, because she does have 1 lung met, and I want to make sure that she doesn't have any more before we move forward with a new plan. Okay, all right, I'm putting you on speaker. This is Maddie.
Hi, Maddie. Hi. I'm sorry, we're kind of going through these bumps, but I just wanted to talk to you about some stuff. What I was getting to was her chest x-rays that Dr. Carey did yesterday showed kind of the same nodule, but we see a few more.
Right.
And the fact that we're dealing with something recurring locally and we're seeing these lesions it basically means biologically her tumor is just more aggressive than the typical osteosarcoma, which I don't like.
She received 1 type of chemotherapy and developed a possible nodule while receiving that chemotherapy. We've since changed her chemotherapy and she's developed additional nodules. So the question is, what do we do from here to try and control metastatic spread, and are we going to be able to do so? This tumor seems to be acting quite aggressively, both at the local site and with metastatic disease. And so before putting Lux through this procedure, we'd like to be as sure as possible that we don't have any other lesions anywhere else.
Because this is behaving atypically, because this is kind of popping up in other places in the lungs, because this has recurred at the site so quickly, what I think is more important is let's do the best that we can to make sure we don't find other areas and maybe other bones. Because that's really rare to have it go to another bone.
That's what she said.
It's really, really rare.
But look, it's come back in.
But this is really rare.
Right.
So I think if we're going to ask her to be a three-legged dog, I'd like to make sure to the best of my medical ability that there's not another lesion in another bone that's hiding.
I could tell that it was upsetting for her to hear and to talk about the statistics and what we were facing. It's hard for owners to kind of picture that and to come to grips with it.
I want to make sure she has a good quality of life. So I'm just taking it day by day.
The reason cancer is immortal and we're not is that it's smarter than us. So when it throws you a curveball, you feel like you didn't do your job or you weren't smart enough. There really isn't a lot to say to an owner when it's time to let their dog go because it's hard. You know, they look at it as they're ending their dog's life, and in reality they're not. You know, it's whatever disease process is happening that's making them feel sick. And doing this job as long as I have, I still get bummed out when that happens, even knowing that I've done everything I can. It's just the way the tumor wants to behave, and you just never get used to it.
Lux was a handful. Anybody that matters, she either loved you or hated you, she tried to eat you, or she sat on your feet and licked you to death, and then she rolled over. She was challenging, and I loved her so much, and I miss her.
We have become friends through this journey, and I think it's helped me. I don't want to put words in her mouth, but nonetheless, I think that just knowing that we're going through this at a similar time makes it a little easier, I think.
People are realizing that traditional cytotoxic chemotherapy, we've kind of hit the wall, both on the human side and on the veterinary side. We can't really push those drugs to any higher doses. We can't give them more frequently because of side effects and because the cancer cells become resistant. So there's a big push to look at cancer from a different sort of way and look at it that it largely is there because of an immunologic problem.
When cancer is at a very, very low level, your immune system is activated and looking at it and trying to kill those cells. But once it gets to a certain volume, the immune system turns off, and that's really, really important because our body, if it attacked things that it thought was abnormal, you develop something called autoimmune disease. So one way that our body kind of protects us from that happening is that if something is very large, the immune system ignores it, kind of looks away. They can't see it. So if cancer cells develop to a certain level, the immune system turns itself off. And that's a special word called immunotolerance. And it's important because even if we kill cancer and we take cancer out of the body and we can't see it, it's one of the reasons we can't cure it. Because even though we may kill cancer down to a very, very low level, the immune system has already forgotten that it should recognize those cells.
The canine osteosarcoma vaccine that has recently received a lot of press is a new therapy utilizing a bacteria that cannot replicate, and it's able to work by stimulating the immune system in the body to recognize proteins that are expressed by osteosarcoma cells. So the idea here is to be able to wake up the immune system, find those cancer cells, and try to take them out before they have a chance to make new masses.
We're in clinical trials now to administer that after amputation, after chemotherapy. If the dog is still free of metastasis at that point in time, then we can consider adding in this vaccine in hopes of really pushing that survival out further.
This Listeria vaccine is so exciting for us. It's the one thing in so many years that is finally giving us more hope regarding prolonging survival time.
If we do surgery alone, it's about 4 to 8 months that they can do well for. If we do chemotherapy, it doubles that time to usually about a year. So they say about 300 to 350 days is the median survival for dogs if they get chemotherapy. So it doubles that time. Dogs with the vaccine, it's closer to about 600 to 800 days was the median survival.
The decision you make is not a judgment on who you are as a person, and it's also not a judgment on how much you love your dog. It's not. Just because somebody else may be able to spend several thousands of dollars and you can't, doesn't mean that you love your dog any less.
Cost is a factor, and what we do for the best treatments is not cheap. It's hard, you know, a lot of times it goes on the credit card, and a lot of times there are things that we cannot do because of cost.
Pet insurance gives owners a feeling of relief that if something catastrophic happens, a real traumatic illness, being hit by a car, disease like cancer, that now one thing that they don't have to think about is the cost.
It makes pursuing these treatments that we talk about or that we can do much more affordable for owners. I have pet insurance for my pets, and I'm a veterinarian because I can't afford some of the things that could happen to my pet.
The number one thing that always has to ring true is how comfortable is my friend, and what I need to do to make them comfortable and not let them be in pain or suffer is the very best decision I can make at that time.
Come here, Barty. Attaboy. Come here, baby. Come here, baby.
Bone cancer is not a death sentence.
That's my boy. That's my boy, Barty.
An amputation is not the end of the world. It changes things, and it changes your perspective.
I think the greatest misconception about canine cancer is that there is no hope, that there is no point in treating it because the answer is always going to be the same. The end point is always going to be the same for all of us, right? But it's about what you do in that time between a diagnosis of canine cancer and that endpoint that really matters the most.
When Bart started his hunt training, he was 6 months old, and it was kind of the agreement I had with his breeder. So at a very young age, I saw the bird craziness that he had in his heart, and I just figured it was up to me to help him foster and develop that innate desire that he was born with. Bart was a little over 3 when he was diagnosed. So he was very, very young.
Because Bart came into this as such a healthy young animal, healthy body weight, free of disease in other parts of his body, and also very importantly, because he had a pet parent that was supportive, willing, and invested both emotionally and in time, and frankly financially, in the ability to do this, he was the perfect candidate.
When I made the decision to amputate Bart's leg, I knew it was what I had to do to save his life.
Good boy.
With the prognosis of osteosarcoma being so dismal, I was emphatic about proceeding out in the field with him, because if he was only going to live for another year, we were going to do it the way that we wanted to live it. We were going to live it to the fullest, and we were going to have fun, and we were going to hunt, and we were going to do what Darcy and Barty did best together. 3 weeks after he finished a rigorous protocol of chemotherapy. He finished his senior hunter title. Within 10 months of his amputation, he completed one of the highest hunting titles that the AKC awards, and he became a master hunter and became the first tripod Vizsla to achieve that title. He also was competing in field trials, and field trials are something where the dogs compete against each other. And so Bart was competing against four-legged dogs, which we called cheaters.
Good boy, good boy.
The best accomplishment, and one that I'm most proud of, is we had the opportunity to go and take a couple of groups of wounded warriors out on some guided hunts. I was encouraging them to get out there and to work with him, and several of them said, just give me a moment. I just am enjoying watching Bart work on 3 legs. It was never anything that impacted Bart's abilities or his enthusiasm. They considered him an honorary wounded warrior. In 2013, I received a call from the AKC to let me know that Bart was one of the finalists for the AKC's Humane Fun ACE Award, which is the award for canine excellence in the category of exemplary companion.
The Kennel Club Humane Fund is proud to honor the recipients of the 2013 award in the category of exemplary companion dog, Bart, a Vizsla, owned by Darcy Hodges of Brookstone.
Bart was fortunate to have 6 amazingly healthy years before he had recurrence, which to me is still the farthest out I can think of any osteosarcoma patient post-chemo and amputation.
He was not feeling well. He was not wanting to eat.
Anytime you are asked to try to fight cancer twice in your life, the second time around is probably going to be more challenging.
He was starting to isolate himself from the family, and I remember sitting on the floor trying to force him to eat. And I said, I'm not going to do this to him. And I had promised him that if he didn't respond well to the chemo the second time around, I wasn't going to put him through it because I knew it would be for me instead of for him. So we stopped after 4 rounds of chemo. I just had to let him go, and I had to protect him. He challenged people's views on what a 3-legged dog could do. And he opened up their minds, and he let them know that the only restrictions that we have are those that we put on ourselves. Bart wasn't 3 legs, Bart wasn't 4 legs, Bart wasn't a body. Bart was that personality and that creature and that soul inside that body.
I really can't put my finger on anybody more than Bart for teaching me about radical hope. Hope that you're not supposed to have because it seems like it's just wasted hope. But that was the lesson I think that Bart taught me, is that there is no waste in hope. That's what you have to hold on to. If there's nothing else left, you have to hold on to hope.
I tell people that this was the best, worst thing that ever happened to me, because I'm a better person for going through this and having Bart on the end of the leash to go through this with me. And I wouldn't have traded it for anything. We didn't let cancer ruin our life. We took control of it, and we made a really great life.
Go, good.
got us doing the happy dance. Will you show us the happy dance? Alright, let's do the happy dance. We do
Miracles can happen. But the thing I do know from what I do is that they won't happen if we don't try. Dogs live in the moment. They live to be happy. They want to run, jump, and play. So when I treat cancer, I'm preserving that amount of time so that they can continue to wake up and see you and be happy and then do the things that they love to do every day. So when I'm dreading entering a room to give a diagnosis, I remind myself of that. And who knows? My name's Dr. Turner. The next miracle could be on the other side of that door.